So next up, I'm thrilled to introduce Allie Nelson, who's a marriage and family therapist. Her focus is on providing effective therapy for individuals with OCD, anxiety.
Did we lose?
I don't know if we lost. Hi everyone, I'm Allie. I don't know what happened to Meredith, but basically I will start. Thank you, Meredith, for starting the introduction. I'm Allie Nelson, formerly Allie Landis, and I started the Wendy Walk and then was super just inspired and motivated by all of the patients that and their families that I came across during the process and wanted to become a professional therapist because I wanted to be able to just spend all my time providing support and help to people. So my current clinic focuses on anxiety, severe anxiety, specifically OCD, but I also do a lot of grief therapy work as well. And I see people from all ages. And I also um, will, I'm also seeing like anyone who has like cancer diagnosis for reduced rate in my clinic. So that being said, we can start the slides. Okay. So the next slide. Great. You all, I noticed, saw the original video we made about Wendy Walk. So I, this is just a little bit of background of how I got into the sarcoma community. And the, I'll start with this scan. So basically, my mom, Wendy, she was diagnosed with liposarcoma, and she was diagnosed uh, before there's been a lot of resources since then. It was like 15 years ago now. And what she went through and watching her attitude informed a lot of the way I delved into my research and my studying about how to support people going through really difficult times. And her kind of ethos was this idea that I'm not my scans. And she had an extremely, extremely aggressive form of liposarcoma that not many people have, like very, very dedifferentiated. All the doctors here are so incredible and were so supportive during the process. And the way that she sort of approached mental health and her diagnosis was from these things listed here. She was very, very, very insistent that she maintain some sort of a routine, her working at the same time, anything that brought her joy. And she would like have a lot of acceptance that like this is not something she wants, not something she likes, but it's something that's here. And she would like cycle from anger to acceptance and then gratitude for what she did have. Um, and something else that was like very transformative for her was this idea that she was a very private person and a lot of the times like fiercely independent. And throughout this process, she allowed herself to let people in, let help in, let family members in, let doctors in, and like let them into her journey and um, into her soul. And that brought her an incredible amount of strength and like really boosted her just her energy, her health, her vitality. Um, and another thing is like she was starting to do things that she was scared of before. Like if she was scared to fly, if she was scared to travel, if she was scared, whatever it was that she was scared to do, she was like, you know what? This is the scariest thing and I'm facing it. So I'm going to go ahead and do the other things I'm scared of. And it allowed her just like this freedom in life that she hadn't have had before. And I got to witness and watch that with her. People that gave bad energy, that sucked out her energy, no time for that. Your body has to heal. So she was very careful about the people that she let into her like inner sanctum because yeah, she felt like she really had to preserve that for herself. Nature, the ocean, hiking, like being around like natural beauty was something that really restored her and helped her. And this isn't the evidence-based part of my talk, but this is just letting you know like what was incredibly helpful for her mental health and what I have noticed through all the other patients I saw and sat with and worked with during my time being with Wendy Walk. And then the last one, which I've heard from a lot of people, is this idea that like she was allowed to be her authentic self. She wasn't worried what people thought of her, said what she wanted to say, lived in her truth, lived in her grace. And it was very empowering for her. So we can move to the next slide. So obviously in this room, any of you know, there's an incredible amount of psychological challenges that come with a cancer diagnosis. These are just some of them. Depression, anxiety disorder, adjustment disorders, post-traumatic stress disorder, just general psychological distress, preclinical level, body dysmorphia, which is when like you just feel like your body's not yourself. You look in the mirror and you think, what's happened? And then because of all the pain and all the complicated emotions, there's also substance use disorders that can become associated. And then survivorship issues, which is I think especially unique and challenging in sarcoma because of this idea that cancer can recur and cancer does recur. So it's like, how are we, okay, people are saying that they can't really see the slides, but anyways, so those are some of the main, yeah.
I'm not sure why we're having this issue, but I just want everybody, I think it was because we were toggling back and forth to a previous speaker. So I think we're trying to figure out how to make sure that we're back on the right screen. So Gail, I don't know if you have a minute to just make sure that you're sharing your screen and that we're not still looking at Dr. Lazar's screen. Sorry to interrupt you, Allie. I just wanted to make sure you're
Other people, yeah, it's all good.
If you could just keep talking and I'll.
Oh yeah, great. Okay, so what I was saying before is although all of those things, depression, anxiety, adjustment disorders, PTSD, and you know, so many, okay, I'm sorry, I'm just looking at the chat. So many diagnoses are relevant to all cancer. For sarcoma, I think something that I've seen over and over again is this idea of like, but is my cancer going to come back? And when is it going to come back? And the anxiety that that creates. And so in that sense, this practice of being present, it's in the slides, but this idea of mindfulness and mindfulness-based CBT, like how in the midst of such a difficult anxiety and fear do we kind of focus on like where our feet are currently, like if there's moments in between surgeries, if there's days that like you feel good and your family's around you, or there's something joyful, like to just try and be as present in that moment as possible. And thank you so much. Okay. Yes. So this is perfect. So ACT therapy, it's acceptance and commitment therapy. It's a therapy that I use often, and it's very relatable to cancer diagnosis. And the quick idea behind it, because I don't have that much time, is sort of what's on the bottom. But the idea is that when we have very difficult situations or difficult emotions, the natural human tendency is to feel like, make it go away. I hate this. I can't stand it. Get it away. And it creates this like fight, this internal fight. And so The concept of ACT is accepting things as they are, not meaning that anyone has to like it or that it's good or that it feels good, but this concept of like letting down your guard and saying like situations are what they are. And with that, I'm going to try and live my life as best as I can. So this idea of values-based living. So this is something that my mom like really put forward, and many of the patients, I'll name Amanda Noble, Diane Walter, Jocelyn, these women that I was in constant contact with, like, what is valuable in my life that cancer is not, that I can still show up for as much as possible, if it's the smallest, even if it's the smallest thing. And even if it can only be for a few minutes a day. This idea of mindfulness, which can be very, very hard, but I discussed before, it's like watching your emotions instead of becoming completely intertwined in them, related to cognitive diffusion, diffusing from them, looking at them from afar. Okay, I see this anxiety, I see this pain, I see this sadness, and trying to see it as a thought rather than like an intrinsic part of yourself. And then my absolute favorite and most important, I think, is self-compassion. Because unlike any other situation where someone would seek therapy or mental health support, a cancer diagnosis, a sarcoma diagnosis particularly, is a very, very difficult situation. So compassion for yourself, love for yourself. Like, no matter what you do that day, like, it's enough and you're enough. And this ties into support and connection. So, like, Sarcoma Alliance is the perfect example of this value and this intervention. Is like, how do we find others going through similar situations? How do we connect with them? How do we tell our story? Does my story help someone else? You know? And then we can go to the next slide. I don't want to take up too much time. Okay, so here are some basic coping skills. You know, some of this might be obvious. Yes, so some of this might be obvious, but basically, you know, a therapist, social worker, counselor. Most centers, while they may not have therapists, do have social workers, and it's totally something that patients can ask for and families can ask for. Like, can I have a social worker in the room? Can I have someone come with me to my appointments? Sometimes they're just underutilized in the facility. Also, a support group, either online or in person, like the one Sarcoma Alliance has. Journaling, you know, how do I feel today? Like, getting it out there. If I'm angry, it's okay to be angry. Does it feel good to write it down, what you're angry about? Letting yourself feel emotions without restricting yourself. Also similar. Like, it's okay to be like, what's happening? Like, I don't like this, you know, moving through the grief of the diagnosis. Finding events or organizations that uplift and provide community, whether it's sarcoma related or something else that you find passion for. Movement. This was one that was very important to my mom. She felt like if she could keep moving, then it made her feel healthy. And I've worked with, there's another woman, Cheryl Fox, who we worked with for many years, and she found surfing, even when she could barely stand up on the surfboard, was like what gave her strength, you know? So it's whatever gives you strength. And it's completely personalized. And then, like I said before, this concept of acceptance and mindfulness, which I can give more resources about. Okay. So here's some more traditional therapeutic modalities. I talked about ACT. Then there's emotion-focused CBT. CBT is cognitive behavioral therapy. The idea is it teaches individuals how to relax during stressful situations, control negative thoughts, think more positively, and engage in helpful behaviors associated with recovery. So it's this concept that our thoughts shape our beliefs, our beliefs shape our behaviors and how to work with that. Once again, it's hard to do, but it's something that has been proven through evidence to help people. And then we have the mindfulness-based and somatic therapies. Somatic therapies are anything that includes the body. Yoga could be considered a somatic therapy. EMDR, Reiki, like anything where you're releasing trauma or fear or pain within the body. And so we can move on. And then here are some resources. So Tower Cancer, Magnolia House has an incredible program where you can have one-on-one therapy sessions. Also, the Sims Mann Center at UCLA offers therapy services for patients. And this is like number 3. There's a lot of resources, and I will say, Anne, I saw your question. I have a friend named Jen Andrews, and there's an organization that she has, Move with Jen. She is an amputee herself, and she has a lot of resources and a lot of things that have helped her. We've actually done talks together, and she was using a lot of the same concepts that my mom kind of would talk about to help her during post her surgery. But I also, not listed on my slides, wanted to say that the thing that's also like I want to say, and I think is very important for people that I see both in my office and just working with patients in the sarcoma community, is this idea of like validation, right? Like what you're going through is very hard. Other people don't understand it, may not understand it. And it's okay to have like, to feel your pain, to express it, to talk about it, and to move through it, you know? And I'll say that something extremely important is to be open as much as possible with the medical professionals, with the incredible oncologists, radiologists, surgeons, that mental health is something that needs to be addressed. And if you're experiencing terrible anxiety or depression and you just really, really don't feel like yourself, it's okay if you can, yes, Dempsey Center. Yes, Patrick spoke about it at one of our walks. It's okay to say to your doctor, please, is there a resource I could talk to? Or like, if it's possible, just sit there for a minute with whoever your medical professional is and just let them know, like, don't have to be strong all the time. And just being able to lean on caretakers, lean on friends, lean on family, and accept that help. And another thing is like, if giving help is something that is incredibly powerful for people. Like, do you want to write your story? Do you want to tell your story? Do you want to talk to someone who's newly diagnosed? Like, not everyone wants to do that, but sometimes it can feel very helpful. And the Sarcoma Alliance is obviously an incredible resource for facilitating that. And then I was talking to one of our sarcoma survivors that I'm really close to. Her name is Leslie Schimmel. She has liposarcoma. And I was saying, like, what helps you? Like, what helps you the most psychologically? And, you know, she said, you know, I talk to myself. I feel bummed. I'm tired. But I say, like, Leslie, we're going to do this. I let myself feel bad. And I come through it the other day. Perspective taking, self-talk, and just repeating over and over again, like, that she loves herself and that she's strong. And she asked me to tell everyone to say, like, life is a crapshoot, anything could happen. And I'm grateful for the little things that I have in my day. And I want to also say, for any caregivers or close friends and family that are listening, all of these therapies all of these therapies are things that, like, you can use too, right? like accepting the fact, accepting changes in the family structure, and accepting all the things about having to watch someone you love be, be in pain. All those things are really difficult. And I only have a short amount of time, but like this idea of like holding space for the difficult emotions and just knowing that like it can pass through, and that your story is the caretaker, your story is the patient, whether you know it or not, inspiring somebody else deeply, um, at the time that you're going through it. And oh, I saw Celeste Immerman. Yeah, I'm an Immerman Angel. That's another amazing organization. I'm going to send like a follow up if people want, with like a lot of um, more specific resources or people that you might want to reach out to. But that's also incredible. You can be a mentor and someone can call you in the same situation. There's a match. Um, and there's also like, I know with Wendy Walk, we can go and we visit Dr. Chawla's office, and go and sit and talk to patients. And, if people are interested in coming and sitting and talking, like you're welcome to. So there's a lot um, available, like in our community. Talk to Meredith or myself about like any more mental health resources. But I have this thing that I've had on my computer forever. There's a young woman named Jocelyn that for a long time, she and I our families worked together. She was part of the Wendy Walk. And and all her family wore shirts that said, "What would Jocelyn do?" Because she just felt like every day, I'm going to just do what I can. I'm going to spend time with the people I love. I'm going to let the love in. I'm going to make myself feel strong. And I have that on my computer to remind me, like any day, like what would Jocelyn do? Like the grace that she had to walk through this disease. So I would like to leave like a minute for questions, because it's a lot to cover in 30 minutes.
Thank you so much, Allie. I'm so sorry. I had this great intro and I was so excited to introduce you and I somehow got kicked off. So thank you for just joining in and starting. That was great. And I know there was a comment about wishing that they would have someone like you for their aftercare. And I just thought that was really sweet. But if you have any questions for Allie, you can put them in the chat. We'll give it a few minutes. If not, Allie, if anyone puts them in the chat and you have a few minutes to, you know, hang out and answer them, that would be awesome. Or if anyone has a question that doesn't get answered by Allie, you can reach out to me, or, Sarcoma Alliance, and we'll get those questions answered.
I just want to respond sort of to what Leslie wrote in the chat. I'm sorry that happened to you, because, being positive and being able to have a positive mindset and like in a strong belief in that good is unfolding is incredibly powerful. And I'm sorry that happened to you. And I'm glad that you advocated for yourself and let the center know. And I wanted to also say it's okay to ask for specialists. Like, do you have someone that focuses on acceptance and commitment therapy? Do you have someone that understands CBT? Do you have someone that understands like grief? These are questions the way you would ask a medical professional. You can also ask for specific mental health needs to be met as well.
Yeah, so someone else said, thank you, Allie. Validation is so important. My family is not supportive at all, and it's been incredibly difficult. So,
and whoever, I don't know, it just says iPhone, but like, please like get my information, because having support and having love is number one medicine. And not only myself, but like my siblings, other people in Wendy Walk, anyone, this is something that everyone deserves a team for. And so please don't be shy to reach out.
Thank you so much, Allie.